What this all means for us in the emergency department as this new wave hits is that we're busier. Our patients are a little sicker, oftentimes very sick, and our staff is working harder, and our lobbies are full. Our wait times are higher than they've ever been at Duke Raleigh. I'm sure that other hospitals can agree to that as well. And it's creating a great deal of stress and frustration, a very understandable frustration. I think a lot of people are waiting in our lobby and in other lobbies around the country longer than they ever thought they would have to wait for healthcare in this country.
The UNC Rex has experienced extremely high volumes of patients. We have over 500 patients in our hospital today, I think 520, and we're a 439 bed hospital, if that helps you put it into perspective. Our ICU beds are full, and just as Dr. Plunk said, the acuity of the patients we are seeing has definitely increased through this pandemic. Part of our high patient census is due to some difficulty really transferring out and discharging our patients. There's a lack of skilled nursing bed availability, not just in Wake County, but throughout the state. We have difficulty finding placement for our geriatric dementia patients. We also have been faced with staffing challenges like all healthcare facilities or systems across the nation. There's a concern that even having a vaccine mandate at the end of September will have some staff choose to leave healthcare because they don't want to be vaccinated. But we know vaccinating is the right approach for our patients and our workforce and our community.
Wake County EMS is also feeling stress of our strained healthcare system. When we transport a patient to the hospital, we need to transfer care to the team in the emergency department, and we just can't just leave the patient if no beds are available. And we have to wait for space to open up. So I want everybody to understand that everything is interconnected. And the longer we wait, less units may be available to respond to the next call. And with our call volume at the highest level in EMS history, the time delays can rapidly add up. To give some context, for fourth month in a row now, Wake County EMS is running more than 10,000 calls in a month. So Wake EMS responded to 10,600 911 calls in July, and we're at a pace that we will actually break 11,000 calls in August, and we're averaging around 355 calls a day. And if you need us, we will be there, but the system is stressed. There are more things as a community that we can do to improve the current situation. First, we need everybody who is able to get the COVID-19 vaccine, which will help prevent you from becoming seriously ill and being hospitalized due to the virus. We also want to urge our community to avoid the emergency department unless you have an emergency health need. Please consider, like our other colleagues just summarized here, if you have healthcare needs, getting early into your doctor's office, look at the telehealth options, urgent cares, other clinic options for those less serious medical issues.
How would you describe the overall condition of hospital health right now? Would you say it's critical, stable? How would you describe it?
I would say critical but stable. Why am I saying that? I guess more important than the words. It's critical because I mean we're at, when you're creating new spaces, including converting lobbies into hospital areas, right? That's critical. Are we able to? And I'm saying stable because we're able to do it and we're doing our jobs and we're taking care of people. So it's stable in that degree, but it's critical. It's critical from a staffing perspective. We're doing our jobs, we're taking care of everyone, but how far can you stretch? And are we at a critical levels with staffing? Yes.